how do we make the correct thing to do the easy thing to do?
This is Stepping Up Healthcare. Your host is Tack, and the mission is simple. Build your capability and curiosity to make healthcare better.
All right, welcome back. We are talking about extra processing today, our last waste in our downtime acronym. In lean terms, extra processing is doing more than what's needed to meet the requirement. Not doing it better, not doing it safer, just more. So let me start with a couple of questions I genuinely love asking when I'm reviewing standard work or a process in general. Who is this step for, and why do we need this step? I don't ask this question to be a nuisance or tough on anybody, but because extra processing happens when we do more work than is necessary, add steps that don't change the outcome, or create complexity just to feel safe, thorough, or compliant. And here's the trick. Extra processing often comes with good intentions. Once again, those sound bites of just to be safe or I'm just going to double check. Extra processing often starts with proactive intent, but ends by having a reactive execution.
Why does it matter?
At first glance, extra processing feels harmless, maybe even responsible. But here's why it matters. Extra processing steals time from patient care. You're just stuck in that bureaucracy and these overly complicated processes just to get even the simplest of tasks done. It increases cognitive load of staff. I know I've talked about this a bunch, but it is wildly important to me. The monotony of documenting or other tasks takes away from time for critical thinking, which is what we pay our staff to do. Next, it hides real problems instead of fixing them. Think of the corporate terminology of Band-Aid solutions or patch jobs. It doesn't actually solve the problems to root, it just covers them up. Also, it creates burnout disguised as being thorough. We're just adding layers and layers of this bureaucracy until we're basically nuking a gnat. It's a terminology I heard from one of my old calculus professors of, there's a gnat in your house. You could get a fly swatter, which would be a good use of that tool, or you could drop a nuclear bomb on your house. It's effective, but wildly overkill. And as a cherry on top, none of this shows up as a line item called waste on a budget. Instead, it manifests as less measurable things like the feeling that we're always behind or documentation just takes forever. Extra processing is like plaque in an artery. Quiet, gradual, until suddenly everything feels blocked.
Let's talk about some real-world examples.
So talking about some real-world examples here, one is duplicative documentation. An extreme example would be a nurse documents vitals in the EMR, and then again in a paper flow sheet, and then summarizes them in a handoff note. 3 times, same data, no real new value created. The patient doesn't feel more healed by this, it's just duplicative work. Extra processing. Number 2, overly complex approvals. Let's think about a routine supply request, something simple like saline or sterile water. In this silly example, let's say it requires a form, and then a manager to sign off, and then a senior leadership to sign off. By the time that supply gets ordered, the manufacturer says it's on back order, and now we're looking for substitutions, or that unit is going to a second unit to steal and pilfer through their supplies. And now that second unit has their par levels off, and it all comes out of the wrong budget, which also requires an email. We didn't prevent waste by making sure we don't order too much. We created it. We created this monster. Number 3, extra testing just to be thorough. Tests ordered for a myriad of reasons, including, we might need it later. This always has good intentions behind it, but provides no real value to the patient if we don't use those results. It also can look like, that's how we've always done this panel. Don't question, just be beat down by the system. This is how we've always done it, so we're always going to do it this way. It can also look like, I don't want to be questioned for my choices. This is fear-driven, which points to a non-psychologically safe work environment. I feel like I am going to be reprimanded for choices I make. Ultimately, if the results don't change the care plan, that's extra processing, even if it feels medically responsible in the moment. Lastly, I was working with a pre-op clinic at one point in my career, and just to order your normal lab tests, the doc had to put a flag outside the door, those little green, red, blue, yellow flags. He had to put one of the flags out. Then he had to put paperwork in the little door hanger file thing outside the door of what he wanted for those labs. Then he also had to put it into Epic to actually order those labs. That's 3 indicators for lab techs who were literally 50 feet away. He could have shouted at them. They probably were making eye contact as he was coming out of the clinic rooms. That is extra processing. So we worked with the lab, we worked with the docs, we worked with the nurses in the clinic, and we were able to eliminate that paperwork part. It was really built because at some point in the past, they missed a lab, and as a countermeasure, added another process just to double check, just to make sure. Rather than, if the lab has questions, why not just talk to the doc? Hey, I noticed you ordered X, Y, and Z. Is that correct? Oh no, I actually meant to just order X and Y. Good catch. Let's talk about safety for a second, because I think this episode really might hurt some of my quality, safety, and compliance folks. To be clear, safety is good, quality is good. I am pro-safety for employees, patients, and their loved ones. But here's the key lean distinction. Extra processing is what we do when we don't trust the system, and we don't trust our staff. I want to introduce a concept called Poka or error proofing. Now that's a Japanese word, and I'm probably butchering the pronunciation of it, so please work with me here. But Poka is about designing work so mistakes can't happen or are immediately obvious when they do happen. Extra processing, on the other hand, it says, let's add another step so we can catch the mistake later. Very different philosophies. Think about how often safety looks like double documentation, triple checks, extra signatures, redundant reviews. Each of these steps is basically an admission we do not fully trust the process we have built. And so instead of fixing the problems, we layer on people, we layer on processes, we layer on these double, triple, quadruple checks, which works until people get tired, distracted, interrupted, or leave for a different position, and that knowledge goes with them. A Poka mindset asks different questions. Why can this error happen in the first place? What in the system allows it? How could we redesign this so the correct action is the easiest action? And that last question is critical. It's the path of least resistance. How do we make the correct thing to do the easy thing to do? For example, instead of double-checking allergies, can the system prevent ordering a contradicting med? Something to think about. Or, instead of asking staff to remember 5 rules, can we embed the rules into the workflow? A non-clinical example would be when you're at a gas station typically the nozzle for the diesel gas will not fit into a regularly leaded car gas tank. This is the difference between be more careful and make it hard to mess up. Extra processing feels responsible. Poka Yoke feels invisible when it works. No one gets praise for an error that never happened. And I'm not talking about near misses. I'm talking about errors that just never happen. So organizations drift toward adding steps because they're fast to implement and they signal seriousness. I am serious about this problem. Let's add a bunch of checks to it. Let's add a layer of bureaucracy to it because we are serious and we want to show it. And mostly, it can be measured or seen. That's key too. You can see that double check process happen through audits or observations or whatever it is. It is measurable. It can be seen. Poka Yoke isn't always able to be seen when there are no errors. But over time, those steps add up and just aren't sustained. Staff become the error-proofing mechanism. And let's be honest, humans are a terrible long-term safety device. People get burned out, people turn over or move positions, knowledge leaves. Lean isn't anti-safety. Lean is anti-making people compensate for a weak system or broken processes. Something to ponder. Ask yourself, if this disappeared tomorrow, this process or this element of the system, what would we be most afraid of? Is it that an error would occur immediately, including possibly a patient harm? That is a signal of an immediate redesign. We don't need to keep adding on to this broken process. How do we help prevent it from ever happening? And lastly, I know if you've been listening to these 8 waste episodes, I sound like a broken record, but I want to talk about time and cognitive load reduction as well. Every step we add consumes mental bandwidth, not just time. Even quick steps require remembering, switching context, and refocusing. Reducing extra processing isn't about rushing or hitting time quotas or being super timely and efficient, at least not at first. You need to do purposeful rounding every hour, 5-to-1 assignment, 12 minutes per patient. No, it's about freeing attention so staff can focus on judgment, focus on patients, and focus on problems that actually require thinking. We pay our staff to critically think, but it's hard for them to do that when they're bogged down by bureaucracy and monotony of processes.
Homework time.
All right, your field assignment for this episode. Between now and the next episode, I want you to pick one task you do all the time. Documentation, ordering meds, handoff, intake, discharge, whatever. Then ask 3 questions. What problem was this step originally meant to solve? Why do we do this? And what would happen if we didn't do it, or did less of it? I'm asking you to challenge how things are done. Just notice it and mentally challenge it. Don't go changing it yet. And see what type of time savings or mental capacity savings might happen if they were eliminated. Well, that's all I've got for you today. Next episode, and the last of the season, is about the differences between observations and interviews to be able to tease out those 8 wastes. I'm Tack. You're appreciated. Let's step up healthcare. Whenever I talk about these 8 wastes, in particular extra processing, I always think of Avril Lavigne's song, Complicated. Why'd you go and have to make things so complicated?